The end of life can be emotional and traumatic for terminally ill patients and their families. What if they had a choice in the manner and time of their death? Several states have laws to allow it, but it's not legal in New York. News 4's Jen Shantz joins us now with a fight to change that. Jen.
Well, Christy, back in May, I stood right here and told you about Susan Rahn, a Western New York wife and mother who didn't want to die on a morphine drip or lose her ability to speak. For her, the solution was a choice: medical aid in dying. Rahn, who has stage 4 breast cancer, became a spokesperson for that cause. And this legislative session, she plans to keep working.
I literally live in 3-month blocks.
That's been Susan Rahn's reality for a while. She's got stage 4 metastatic breast cancer, and with each PET scan, she has to prepare for a different fate. Rahn is an advocate for medical aid in dying. We first spoke with her in May. The woman we met was a fighter. She wore her armor on her wrist in the form of a tattoo, reminding her that brave girls are enough. Despite being 40 pounds thinner, that fighter isn't backing into her corner just yet.
This isn't something I want my son to have to watch when I run out of options.
Rahn plans to fight her illness until the end, but says when the fight is done, she wants to die on her terms.
Medical aid in dying is all about patient autonomy. It's about allowing a person to make an affirmative request. No one can suggest this to someone, to make an affirmative request for help in the form of a prescription.
Frankly, it's a prescription Rahn says she's not even sure she'd take if she had it, but she wants the option. So far, only 6 states allow medical aid in dying. The mayor of Washington, D.C. recently signed a Death with Dignity Act, but that's now being fought in Congress. Corinne Carey works with Compassion and Choices, a nonprofit working to move medical aid in dying legislation forward. She's confident New York will eventually pass the bill. She's just not sure when.
I know the work ahead of us for our campaign and for our supporters is sitting down individually with each one of those lawmakers, and that takes time.
Last session, New York's bill passed the Assembly's Health Committee. Rahn wants to speak more this session and hopes to even address Governor Cuomo personally. The bill isn't without its opponents, the Catholic Church, for example. But after losing friends and family members to terminal illness, Rahn wants people to understand why this choice is necessary.
My son is 17 at this point. He's going to be graduating from high school. I know that I won't be around when he graduates from medical school, and I don't want to negate all of the awesome memories that he and I have together, because having him watch me in a bed and suffer and go through the dying process, it's basically going to wipe those memories away.
New York's medical aid in dying bill would only apply to terminally ill adult patients who have the ability to consent and then ask for the prescriptions for themselves. No medical provider would be required to give it to them. Rahn will be speaking in Albany on this issue in the next couple weeks. Live in the studio, Jen Shantz, News 4 at 5:30.